Listen, welcome everybody. So glad you're here for our Helios Lab information session for summer of 2024. My name is John Bilomek. I'm the faculty director of the Helios Lab and a faculty member in our Department of Family Medicine. I'm a health equity and health services researcher, and the Helios Lab is kind of the bread and butter of all the research that we do to try to advance, a more equitable healthcare system and connections with our communities. Yeah, so let me just start by saying, this is a picture from our most recent year-end banquet. So you can kind of see we're a big group, so there's usually about 25 to 27 undergraduates in the lab, several, including around 3 postbaccs usually. And then there's a number of medical student and graduate student mentors who participate. Also, some people who are recent graduates that are kind of in gap year growth years before applying to professional school of often medical school or graduate school of different types will be with us. William's mom is in the picture too, so she counts. So anyways, it's a wonderful group, and we get to do a lot of work together, and we really like to celebrate kind of the accomplishments of our students that are really like kind of rising up to become leaders in the health professions. And now I'll kind of just say a little bit about what we'll be covering. So first, I'll just talk a little bit about who we are, and just who our team is, what we do, like what are some of the projects we're up to, what we expect, kind of what the requirements of being in the lab are, what you gain, some of the opportunities that happen in the lab. And during this time too, I think we'll just have a little bit of opportunity to kind of talk with some of the current student members. We'll share a little bit about something they've taken from their experience in the lab, and then lastly, I'll just tell you kind of how you can apply to potentially become a member of the lab. So the Helios Lab is a student-led research lab. We were established in 2017. And we've been just really focused on providing community-based research and clinical experience opportunities. So that's kind of where we started. It was just, there's a lot of undergraduates who are interested in the health professions. Everyone hears that, like, well, you have to do research to be competitive for, medical school or any health professional school that you want to apply to. And yet many of us didn't grow up wanting to be researchers. So sometimes you almost have to feel like I have to tell the faculty member I'm working for, like, oh man, these fruit flies are the best, and oh, I love pipetting, and so which is great, and that can be those can be really fascinating forms of research across the whole continuum of research. But we really just wanted to focus on what are ways that we could engage students that really want to work with people in a research experience that allows them to kind of really kind of go to their strengths. So we study, topics related to health inequities that affect marginalized and historically excluded communities. And then we really try to focus on offering some skill building around leadership, and I'll talk more about kind of the objectives of the lab in a minute. But our mission is basically, we do want to help create a more equitable healthcare system. We kind of started, I started my career basically just doing research on the healthcare system. And I was never that interested in breakthrough treatments, kind of to come up with what's the cure for this new, this disease or whatever, because I just felt like, man, there's so many really effective, life-changing and life-saving therapies that many people in our communities can never access. And it just seems unfair and a complete waste. And it just feels like, man, there's so much opportunity in that space. And then when you add on top of that, all the opportunities that come with prevention, it's almost like dealing with inequity is a breakthrough treatment. You know what I mean? It is discovering something that's transformative, to the world. And so I thought, well, I'll do this with research. And then I realized, research definitely breaks progress in this, but in almost every research paper I ever wrote, I'd always say something to the effect about, and if the healthcare system was more representative of the communities it serves, and was more responsive to the priorities and circumstances of marginalized communities, then many of these health inequities would be reduced substantially. And then I realized, I work for a medical school. And so then I felt like, well, there's an opportunity there to help support people that have a real heart for equity, and just, just people that are super intelligent, empathetic, and just really committed to reducing inequities. What if we really just focus on helping develop their capacity to become future healthcare leaders? So we try to work on improving the healthcare system by developing the evidence for what are the changes that need to happen, and then really helping prepare the leaders who are going to go out and make those changes in their healthcare settings. So to really focus on that commitment, we do a year-round curriculum. The curriculum starts for most of us in the fall quarter. So anyone who applies this summer would start in the fall. And that's where we really kind of focus in on the health equity lens. So we teach you kind of the research techniques that you need to do, the kinds of research we do, interviewing patients, conducting questionnaires, doing outreach. We take blood pressures. We help reconcile what different kind of medications patients are taking. Just really try to just a lot of things that just relate to patients' experiences in the healthcare system. But we also, on top of learning those techniques, just learn about why does health equity work need to be done, and why are you the one to do it? So I'll really focused on finding your professional identity in the context of health equity work. Then in the winter quarter, every student continues to work on the lab-wide projects that are going on, but then all the students participate in small group projects that we call micro projects, where you'll do some research, where you'll collect some new data or analyze data that we've collected. Again, talking to patients, talking to community partners, learning from data and sharing it back to the community in different ways through these micro projects. And then in the spring quarter, we take those projects that are kind of bite-sized, that are things that can be done in a matter of 8 to 12 weeks or so, and then present them at the undergraduate research symposium at UCI, and just learn, like, how do we present our research visually? How do we talk about our research? How do we give an elevator pitch about our work? Like, we really focus on that scientific communication. The last few years, we've added kind of a summer component to the curriculum. So the HELIOS members that are here today are part of our summer term. And so they've experienced at least 1 year in the lab already. And then during the summer, this is the time where students really level up and become kind of the next leaders in the lab. So we have a number of leadership committees that we'll talk more about later, different kind of leadership and service activities that we do. And our students kind of assume those leadership positions in the lab. And then also, of course, in the summer, this is where people work on developing their own research questions for next year's micro projects. So instead of being just another group member in a micro project, that they really are situated to lead the next year's micro projects. So the curriculum is year round, and we really look for students that can stay with us at least for 1 year. This is kind of the summer experience, what we're talking about. So during the summer, after your first year in the program, if you do the summer leadership experience, you go visit different community sites, community partners. Just today, we were with the Madison Park Neighborhood Association in Santana, a very has a designation as a disadvantaged neighborhood community, and really looked at their environmental justice efforts and their kind of education, health equity efforts from the nonprofit sector. We try to build, cohesive cohorts of equity-minded students. It's really important that you don't just try to tackle inequities by yourself. You'll find that in many settings where we work, that maybe there's some talk about equity, maybe not, but there's only so many real ride or die people that are just really fully committed to a mission of equity. And that can be very isolating. You feel like, man, what am I even doing here? So we really want to form a strong base and cohort of people that will be your crew kind of during the experience in the lab, and hopefully carries forward afterward. And now we have a network of somewhere around 100 alumni now that also come back and support each other and support our current members. I talked about collaborating with different community partners. We do a lot of outreach work. So at our UCI operates 2 kind of clinics that are called federally qualified health centers. Those are basically kind of what they call safety net clinics, sometimes clinics that serve medically underserved communities or medically underserved areas. Those are places where there's a very low concentration of health professions and a high concentration of socioeconomic disadvantage. And so we collaborate very closely with them and do outreach and education around, cancer prevention, a lot of preventive health, a lot of, different campaigns that their population health team is working on. Often those become the foundation for some of the micro projects and other research projects that we do. We learn from dynamic leaders in the health professions and from community spaces that we bring in guest speakers and have panels and guest speakers during our Friday lab meetings to kind of just bring more knowledge and inspiration as you're, charting the course for your professional journey. We talk a lot about what are the ways that health equity research and you can help drive systems change. So we really like to see where our work has impact, and we talk a lot about the different ways that this does it. But one of the most important ways is, of course, by transforming yourselves, by ourselves, in the work that we're doing, just that we become more empowered to be agents of change. As I mentioned, all HELIOS members present collaborative research projects at local, regional, or national conferences. So everyone presents at the UCI Undergraduate Research Symposium, and many of our students, if they're interested, kind of level up and prepare their presentations to be at other professional conferences, which are wonderful, ways to disseminate what we learn. And it's also very just good for your resume as well. So, and also just for your confidence, one of our big NIH-funded projects that we've been in the midst of is called Mi Propio Camino. It's a project that's focused on helping support Latinx patients who have been struggling with blood pressure control, and helping kind of those patients experiment with and find approaches to managing their blood pressure that really work for them. And Mi Propio Camino means my own path. So just how do you find a path that works for you? We collaborate with the Family Medicine Residency Program and in their different scholarly activity projects. So this is one example. We helped create bilingual patient education videos around diabetes and evaluated different aspects of those. So a lot of times our micro projects connect directly to the care that we're delivering in our federally qualified health centers. And in general, just really relies on having student members that are just amazing ambassadors of the university that really help build bridges. The university can feel like a million miles away from communities where there's, from families where they didn't have a lot of formal education. And so many of our student members are first generation students themselves, are immigrants themselves, or the children of immigrants themselves. And, it's just amazing how much the patients we work with just light up at just seeing man, look what you're doing. This is great. And you care about little old me. And there's just so much sweetness and our connection that we have with patients and community residents. So again, we do research to know what it takes to ensure an equitable and trustworthy healthcare system. We honor our graduating seniors with a graduation stole and a really fun and beautiful banquet. And Adriana, who's here and is going into her master's program next year, she was one of our HELIOS graduates as well and has worked with us for the last couple of years. And of course, our alumni end up enrolling in top-tier medical schools, nursing programs, PA school, pharmacy programs. Before we were officially called HELIOS, I had one dentist. I got to hit him up for donations. Actually, he's probably very rich now. But just our students really do, I think, find the experience really helps propel them into the next chapters of their career journey. I talked about how we are drivers of change, and just really want to encourage everyone to, just to visit our website if you haven't already. I'll point to a couple of other links, but rather than just show you pictures of some of our team, I want to maybe just have, each member of our team. So maybe starting first with Tanya and Adriana, and then asking each of our student members that are here just to say a couple words about your role in the lab, and then just something that you've taken from the experience of being in the lab, or something you've done that has stood out and been impactful. So So Tani, do you want to say a couple words about your role? Then we'll go to Adriana, and then we'll go to the students.
Sure. Yeah, so as the program manager, I kind of oversee the lab, but also mainly our Mi Propio Camino blood pressure study that Dr. B just mentioned. We're wrapping that up this month and next month too, actually. So I was overseeing that, and then yeah, I mean, just looking at the student schedules, overseeing the remote shifts. So we do have like in-person shifts and also remote shifts for our students. And what else can I say? Uh, yeah, I'm not sure what else to say.
That's great. I think it's really good. And also I think you support the curriculum, that you help,
Yeah.
like you're supporting kind of our leadership initiatives to really help like set up opportunities for our students to contribute to those pathways too. So that's great. Adriana, do you want to share a little bit about some of the things that you've done in the lab or things that have stood out about the experience?
Yes, let me see if hopefully it doesn't cut out. It's already kicked me out twice. But yes, I am the field work coordinator with the lab. So the field shifts for the Camino study. So I did a lot of recruitment with the students, training with, HIPAA, informed consent, doing some follow-ups with the patients now that we're kind of at the tail end. Some workshop with students like how to create an abstract, poster presentations. I started with the Helios lab as a student. So I was kind of witnessed a little bit the start of the NPC study and now the end of it. One thing about the Helios lab that I really appreciate, I know as like pre-med students, some of your classmates might have not been the best people in general in terms of, I feel like I don't want to call people out, but I feel like if you know. So with lab, I was also part of camp at UCI. With Helios lab, I saw the empathetic side of pre-med and some students that I might have not met in my classes since they're so big, and kind of that social support and network with other pre-health students going to UCI at the moment.
Oh, thanks, Adriana. That's beautiful. Yeah, I would say in general, it's a very collaborative environment. And I do think a lot of the pre-health classes, it gets kind of cutthroat and people kind of, I don't know. I mean, listen, like what I'll say, and I'll talk about this in other ways, like when you're in the lab, but I do think that, there's some people who's just like, who have enormous confidence and success in academics and in standardized tests and really do possess, a lot of intelligence and gifts. But sometimes that's like all they have to offer, you know what I mean? Which is like important. It's important that some of our doctors have those particular skills. And then it's also really important that not all of our doctors only have those skills. You know what I mean? And so I think everyone in this room is going to really continue to excel academically and grow and do everything you have to do to be well over what's required academically, and will also have brought something else, something more, something that those others can't offer. And so it's just, I think so much of the connectedness of our students is seeing this, that everyone sees the strengths in each other, and that we don't have all the exact same strengths. And I think, yeah, somehow it just feels like a much more collaborative and less competitive environment. We're always happy for each other when people level up to the next thing. And so it's really beautiful. So wonderful. Thanks for sharing that, Adriana. Let's see. Amanda, do you want to share a couple words about your experience in the lab or things that have stood out about it?
Yeah, so a lot of us in the lab, we're usually either first generation, we come from disadvantaged backgrounds. Me personally, I'm a first generation Filipino, and I also am in the disabilities student service. And so I think the reason why I joined Helios in the first place, because I really wanted to find a research lab that not only like has an emphasis with making these personal connections with patients, but also provides mentorship, which is something that's really hard to find in a typical research lab. And so one key takeaway I can take from the Helios lab is definitely the shadowing experience that I received from Dr. Tran and Dr. Tu, and also Dr. B's mentorship, because again, like I think it's really hard to find a PI that's like really caring and wants us to succeed even after we graduate.
That's awesome. Thanks for that, Amanda. Yeah, I really hope people feel that way, and that's wonderful to hear. Naomi, you want to share a couple words about your experience? Yeah, go ahead and say again. I heard just the very last peep of what you said.
Can you guys hear me okay?
Yes.
So I definitely agree with Amanda and Adriana because we focus a lot on health equity and lots of mentorship, which is like 100% super true. But another thing that I would like to touch on is just being surrounded by like this community of, supportive like people and students, and also kind of being involved with like interacting with patients who are in the underserved communities and being able to make an impact on them is very motivating, especially since if you are in pre-med or like pre-health, it can be a tough road and it can be like just, really hard sometimes and too much. But being exposed to this like once a week or twice a week, it just gives you that motivation to just continue going. Like, this is exactly where I want to be in the future. This is like the focus that I want to focus on in the future. And it's just a really good reminder of why you're doing what you're doing. So definitely mentorship, definitely really good like support system, but also personally, it's just a good reminder of my why. Like, why am I continuing this? Like right now I'm studying for my MCAT and Helios is always in the back of my mind. Like, yep, this is why I'm grinding so hard right now.
That's wonderful. Thank you, Naomi. That's beautiful, beautiful to hear, and thank you for saying that. And now Denise is very new to the lab, so we'd love to kind of just hear maybe some of your initial impressions, kind of coming in as a brand new member.
Yeah, so I am very new to the lab. I think I just started participating in a lot of the follow-up visits like this past week. But I initially joined Helios because I was a volunteer at the federally qualified health center. This was like before the pandemic hit. And I participated in a lot of the group medical visits where you can kind of follow up with patients for a long period of time and you establish like a rapport and you see like the struggles that they face when, dealing with their diabetes, their hypertension. And in doing that, I was able to establish one of the teaching curriculums for the teaching kitchen, which was very impactful for me because one, I love cooking, and then two, it kind of combines this, I am helping the underserved population. That reminds me frequently of my parents. And then kind of after COVID, I was left with, well, I know the difficulties that a lot of these patients face, but like in my career, how can I address these issues in a more one-on-one setting or understand the difficulties that a lot of these patients are facing? Because a lot of the times, whether you're in healthcare currently or you will be later, a lot of people are just like, well, this patient's just not taking the medication. They're non-compliant. And I think there is a part of empathy that comes with joining Helios, that, in addition to the camaraderie that we all have, I think that's what has motivated me to join and be an active member this upcoming year. And then additionally, with joining the MPC follow-ups, I've also been in charge of the leadership community involved with Learnal Club is what we call it. So kind of getting a lot of our lab members familiar and kind of interested in reading journal articles related to our research, and creating a comfortability, because I think a lot of the times when we think of journal articles, we can be very overwhelmed. So kind of that's what I will be planning to do with Angelisa, who's not here, but both of us will be planning a session to lead in the fall. So yeah, that's my 2 cents.
Thanks so much, Denise. Yeah, we're really so glad you joined and that you found these points of connection. And so I just think it's great. I think everyone kind of finds a role and a place and kind of, again, a crew of people that they can collaborate with. Just to give a couple examples of some of the projects that our members have worked on, so we have, again, another great link is the helioslab.org can go to our presentations page, and you can see, we've done work related to interpreter access and how that affects the quality of care patients receive. We've looked at issues regarding food insecurity and hypertension management. One student started doing some evaluation of some of the impacts of the HELIOS lab curriculum itself. We've done focus groups with patients on the topic of cardiorenal syndrome when there's both heart-related and kidney-related dysfunction, and how managing those things concurrently is complicated. We studied about the importance of emergency savings, how few of our patients have emergency savings, and what a difference it makes when a person, even if they haven't experienced food insecurity specifically, when being on the brink is extremely challenging on its own. We've studied statewide. We've used kind of statewide data sets to understand how race and discrimination kind of relates to using the emergency room for preventable reasons. And also, again, Amanda mentioned shadowing one of our family docs in our FQHC, and we've been talking to our patients about the barriers they experience related to cervical cancer screening. So those are just a few of the projects we've been up to. You can see for the last few years, different things that we've been working on. Those could give you an idea of the kinds of things you might be a part of. The Europe Symposium is a big cornerstone to our year. That's held every year in May. So the Postbacc, y'all will be on kind of dedicated MCAT study time. So the Postbacc students typically don't participate in Europe just because you need to be focused on the MCAT. Although, we're really happy that our Postbacc students were able to attend our end of year banquet, which is around the last week of May. Our students were recognized, received numerous awards, and did just a really outstanding time, had outstanding performance. For our student leadership committees, we have an external communications committee that manages our Instagram page. We do a quarterly newsletter, and they just do an amazing job with this. Our social committee kind of helps, put together our banquet and other activities throughout the year. We have a beach celebration in the fall. We celebrate Helios Giving, where we kind of focus on gratitude kind of at the end of the fall quarter. We have just a number of different kind of social opportunities that we spend time together. We have an engagement committee that focuses on helping people get out to both community service opportunities and learning opportunities, going to things like the LMSA, SNMA pre-health conference, or UCI's Open Medical School, or other pre-health or professional development conferences. Also to help people get connected to just some of the great, talks that are going on in the community, talks, workshops, leadership development opportunities, conferences, where people could be learning more about what's happening in the community, what are the drivers of health inequities, what are approaches that have helped respond to some of those inequities. And then lastly, we have our mentorship committee, where we help bring in, people that can help serve as mentors to our students, and can also be mentors to more junior students. We kind of recruit the lab in a way that about half of our members graduate every year. So that means half of our members are returning students, and we really try to pair those more experienced students with the newer students to connect them. And again, the Postbaccs play a really important part in mentorship as well. So what we expect, I think the things that are really critical is being able to attend our mandatory lab meetings. So our lab meetings are Fridays from 3 to 5, which we came to this date because very few instructors are cruel enough to have class on Friday afternoon. So that's almost the only time that we could all meet pretty consistently. So you really have to kind of work on, now it's not a class you enroll in, so you'd have to really arrange your schedule to be free on those Friday late afternoons. And it's possible for a quarter if we have to make an accommodation, it can be possible, but we just really need you to be available then. You have to be just very ready to help create community within the lab. So just to be willing to connect, to be willing to attend these outside experiences, like I said, some of the service and conferences and learning opportunities that we do. Those are just things that are foundational to doing health equity research of this type. And so it's in the same way you have to learn the techniques of a chemistry lab or a biology lab, or you have to learn the techniques of community engaged health services research, and that's what this is all about. you have to be passionate, and passion isn't described, it's revealed. You know, it's something you can't just say, I have a passion for something. You know, we need to see your passion. And so I think we want to see what are the ways that you're showing up for each other, showing up for the community. You know, we're interested to learn about that, about you. And then just so you know that we kind of break down, you know, we are really looking for students who can enroll in 4 units per quarter. It's possible that for a quarter or so, you know, you might be able to go down to 3 units. 1 unit is really focused on just doing our Friday lab meeting and the curriculum, and some of the outside activities that we do related to that. And then the other 3 or so units usually has 1 field shift where you need to have like a 4-hour block, either an entire morning or an entire afternoon, kind of like a 8 to noon or 1 to 5 block, 1 day per week that you can consistently be at the clinic or at one of our partner sites. And then the other shifts that you do are usually remote shifts that we give you kind of asynchronous work, maybe calling patients to check in on them or to remind them about an upcoming visit, helping us organize data, helping us prepare materials for things that we're doing some of the work related to the leadership committees, you know, things like that. So we kind of have remote shifts as well. So you're working approximately, every unit is the equivalent of 3 to 4 hours of work per week. And so that kind of amounts to 4 units is the equivalent of, you know, 12 to 16 hours of work per week. And then what you gain, yeah, we just think there's opportunities to learn about research, to participate in the research process, to gain meaningful experience in clinical and community settings, to support and to get support and guidance in your pre-health journey, and to network with health professionals, researchers, and like-minded students. That's, I think, what you get out of it, and we really hope it's a high-value proposition for you. And so the last thing I'll close on before we open it up to questions and answers is what are the next steps? So our applications are open now, and you can submit an application at the helioslab.org/opportunities. If you sort of scroll down, so we read through the whole page, that tells you more detail about what we're about and what's expected. And then at the end, there's the instructions of how to submit your application. No letters of recommendation or transcripts are required. No minimum GPA. We're not interested in the people who all they have to offer is their academics. Well, I mean, we might take 1 or 2, but like we really like people that have other things, you know, things in addition to that to offer. And our priority deadline is this coming Monday at midnight. So you know, so really love you to work on it this weekend. But admissions are rolling, and so like if after this priority deadline, you know, if you submit after that deadline. And if there's still open seats after this round of interviews and placements, you could still potentially get into the lab. We usually don't fill 100% of our seats from the priority applicants, but you have, you know, the most seats are available if you manage to apply before the priority deadline. Like I said, if you're selected for an interview, we'll be conducting those kind of in the last 2 weeks of July, maybe some into the beginning of August. The positions will begin during week 0 of the fall quarter, which is kind of like, I think, the second to last week of September this year, I think. And then, but between being accepted and starting the lab, there are a number of steps to be cleared to work in the clinics and to be approved to enroll in the research unit. So, you know, so once you get your notice of acceptance, there'll be kind of a checklist of things to start working through this summer, and you have to kind of start on it pretty early because, you know, some of those steps take a little bit of time, like to get your vaccination records updated and different things like that. So, so I think that kind of concludes like my talking part of the presentation, but I would love to just take any questions, you know, from the room. And yeah, so let's start with that. What questions come to your mind, you know, after hearing about all this? You put questions in the chat too, or oh, I see Brian. Go.
Yeah.
Hi. So one question I had was, so I know that the postbacc students usually, like, if they do the Helios lab, it's gonna be like for 6 months rather than like the full, like, you know, 9 months as it would be. So one thing I was just wondering is that, like, would it be the same, like, what postbac students would be doing as like like other undergrad lab members during those 6 months, or do postbacs kind of do something different?
It's quite similar, I would say. So yeah, you're still doing kind of that combination of one field shift a week usually and remote shifts. And then it's just sort of like kind of following kind of your readiness to do this stuff. So sometimes postbacs end up like picking up some of the processes a little bit faster. So oftentimes you end up kind of like stepping into roles and even helping like coach up some of our new student members. So that's one thing that's a little bit different. The main difference is in the micro projects. We really expect you to kind of contribute and support during that winter quarter, but recognizing that you may not be super involved in the kind of the analysis and preparation stuff in the spring. And so it's a little bit of a different, so you'll have a different feeling in the project. Like you'll kind of feel almost like a little bit like a mentor more than just another team member, because you're sort of thinking about, okay, what do the other members of our team need to be ready to present in the spring, like when I'm not there with them anymore, So I think that's one thing that feels a little bit different. And then also I think most years, I think pretty much every year the postbacs usually put together a little bit of a panel, to kind of talk about their experiences, that kind of brought them into the postbac program and to a career in medicine. And so that's usually something that's a little bit different. But yeah, you otherwise would get really similar experiences. Let's see, I see Kieran's question. Yeah, so 2 questions. So yeah, no, so Spanish fluency is certainly not required. I mean, there's certain interactions that we do work with a lot of monolingual Spanish speaking patients, and we work with a lot of patients that use English primarily or regularly, and also use other languages. So I think we have plenty of students that use Spanish language comfortably and plenty that don't, and we all just kind of support each other in different ways. And so basically if you don't use Spanish, you would just be reaching out to patients that use English, or maybe some of the other, it sounds like you said you speak multiple languages, and so there's many times we work with patients that speak a language that's other than Spanish or English. Accepting applications from students at other colleges. Students that are enrolled at another college, it can be pretty tricky to be enrolled in the lab while you're a full-time student at another college. It's oftentimes like someone's a little bit easier actually after graduation when you kind of have more flexibility. So it's not out of the question. I'd be totally interested to talk with you or anyone that would be interested in getting involved in the lab from another university. It is. So it's not limited only to UCI students. It's just that practically there's just some logistical things that make it tricky if you're not a UCI student to be able to participate. So we could talk maybe offline about more of those details if you're interested. And Kieran, and there's other ways too that we'd love to support you. I'd love to learn more about your journey and think about what are ways that we can be of support. Even if you don't end up becoming a full member of the lab, so really happy to talk with you. Tanya, I don't know if you want to drop my office hour link into the chat, the bit.ly/meet Dr. B. That'd be helpful. And then Marie, after the postbac program, absolutely, you're able to come back to continue the research. Oftentimes our postbacs will come back in the summer. After finishing MCAT, and especially if they're going to enter the cycle that coming year, it's a great time to come back in. And what's nice is once you've done the program, even for that 6-month phase, during the postbac, it's easy to kind of jump in and you can just sort of like help out a little bit or be very involved, So there's that's a very easy open door for postbacs to continue. Kathleen asks, how large is the new incoming cohort? It's usually about 10 or 12 new students join each year. We have about 25 to 27 members usually, and about half of them end up being new students, just a little bit less than half end up being brand new. So it's about 10 to 12, I think, would be accepted this year. I see a question, what clinics are we able to serve at? Most of our work occurs at the UCI Family Health Center in Santa Ana on Main Street, kind of Main Street near 8th Street in Santa Ana. But we also do work, we did work with an FQHC in Northern Orange County called, is it Family Health Matters, right? That's who we worked with. You know, and we've worked with other clinic partners as well. Not too much in Irvine. You know, there is the WEN Center is kind of our UCI's new space in Irvine. We have not yet worked there, you know, even though we have some family medicine doctors there. So it's mostly, oh, I'm sorry. And then the other site we often work at is the UCI Family Health Center in Anaheim, which is a little bit further away from the campus, but that's a possibility that some of our projects take us there. For example, on Tuesday afternoons, there's diabetes group medical visits that occur, and a couple of our students generally support those the group medical kind of group education classes that the clinic offers, and then we conduct, you know, help support those classes, just help facilitate and work with the patients, but also do kind of questionnaires and, you know, like evaluate like what are the impacts of those classes on the patient's experience. What other questions come to mind? Well, this is great. Listen, I mean, we're so happy that you had this chance to, you know, we had this chance to kind of meet you. It was just really, even just doing quick introduction. It was really cool just to put faces to names and just learn a little bit about where you're coming from and things that you're currently doing. Really excited to you know, review your applications and to talk with you in our interview process. You know, like I said, HELIOS is, you know, I think is really a wonderful opportunity for a lot of people, and I wish we had the capacity to take even more than we do. Although I think we are one of the biggest labs on campus, you know, with in terms of undergraduate participation. But we're also really connected to other groups that are doing really exciting health equity research too. So maybe if we don't see a perfect match, we can also make introductions and be really supportive to you. You know, there's a student that applied to the lab 2 years ago, and it just wasn't really a spot. Like we just couldn't really find a way to kind of make it work because of a few different things. And that student now is involved in the Prime Pre-Health Pathways program, which is another amazing program on the campus. And now, like I see him every week, and we're working on stuff. And he's found other research experience, but we're still connected. So what's beautiful about the health equity world? Remember, I said it's kind of rough that it's sort of a small group. Sometimes you have to find your crew, but the good news is it's because it's kind of small, you usually end up working with the people. If you don't work with someone right away, you often end up becoming connected with them later. And that's something I think would be a really, you know, that's something that could be a real opportunity for y'all as well. But listen, I think we're kind of to the end of our time now. I'll definitely hang if there's any other questions. Please feel free to book an office hour with me if it'd be helpful to talk one-on-one. And like I said, we'll just be looking for your applications. If you can apply before the priority deadline Monday night at midnight, like I said, we're really excited to review and hopefully invite you to interview and learn more about your passions, your motivations, and the ways that we can help support you in your journey. So yeah, thanks to each of you for joining this evening, and look forward to continuing the conversation in the near future. Y'all take care.